Hi, so today we're going to be talking about laser hair removal. What is it for? It's to reduce your hair, so it's permanent hair reduction, not permanent hair removal. So the aim is to make sure that your hairs are much more finer, thinner, vellus, so it will get to a point where they will be there, but you actually won't visibly be able to feel them or see them. So all in all, it saves you time from shaving, waxing, getting those ingrown hairs or darker patches of the skin. So generally what we would do is we'd need to assess the skin and the hair and do a patch test for you. The patch test is just to ensure that we have the correct settings and there isn't any form of bad reaction on the skin. What does it feel like? So it feels like a flick of elastic band sensation. There will be some cool air, so that will help to keep the skin quite cool. And generally the treatment is a little bit uncomfortable, but it's absolutely fine. For the face, we would recommend a minimum course of 6 treatments. This will be done every 4 to 6 weeks with maintenance thereafter. As facial hair tends to be hormonal, it requires a few more maintenance treatments. In regards to the body requires, again, a minimum of 6 treatments, and they're every 6 to 8 weeks. And your maintenance may be every 3 to 6 months as a top-up. In terms of the downtime or side effects, there will be slight redness to the skin. You won't really have much sensation thereafter. You may apply aloe vera if the skin does feel slightly sensitive. The area may feel a little bit bumpy, and this is where the follicles are slightly inflamed, but that should subside within that same day. And most importantly, SPF. You must wear an SPF 50 or higher daily to protect the skin from the UV and to develop any further pigmentation, whether it's darkening or lightening of that. A lot of people think that actually by shaving it, does it make it worse? No, because it's only cutting the hair from the skin surface. We would advise against any form of heat treatment, so hot saunas, steam rooms, hot showers, any strenuous exercise, and swimming for 48 hours post-treatment, just to ensure that you've got correct healing time, and avoid using any acid-based products like salicylic, glycolic, lactic, and vitamin A. So on the treatment, I would wipe the skin to make sure it's clear of any makeup or any creams that you've applied. We will then apply the goggles. This is to ensure that your eyes are protected from the laser. So they will be either blacked out goggles if we're treating the face, or it will be bigger goggles if we're treating the body area. We will then set up the machine with the parameters and let you know when we're starting the treatment. If you need to stop or in any form of discomfort, you may raise your hand and we can go it according to your pace. Once we've completed the treatment, we will apply some soothing aloe vera gel for you, followed by sun protection. Your aftercare will be mentioned again verbally and also sent by email. The laser essentially heats up the follicle and that detaches the hair away from the blood supply. So this causes a weakening of the same follicle for every time that you come for a treatment. We need to make sure that the hair is in the correct phase of the hair cycle. So generally we say we catch about 20% of the hairs on every treatment that you attend. So we use Cynosure Elite. So we have 2 different types of lasers. We have one for lighter skin types and one that is extremely safe for darker skin types. So we're able to treat from skin type 1 to skin type 6. We have an Alexandrite laser and an ND laser. I have previously used pain-free lasers. I just feel like they aren't as beneficial compared to the Cynosure, purely because the laser is directed deep, straight, directly into the follicle, and a lot of the energy is not wasted on surrounding tissue.